Are you doing? Karibuni sana. It's really nice to be here with you on this beautiful show of Afya Clinic right here ndani ya MBCI TV ambapo tunabadilisha maisha by the grace of God. I'm very delighted, very blessed to be here. It's really nice to see another Wednesday. I hope that you've been well since last week on Wednesday, and I hope that you've had a blessed week. I'd love to know how you're doing, how your week has been. What are you thanking God for? It's now Feb. Yeah. I just say Feb because my ancestors may just decide to do the L and R thing. So it's now the first Wednesday of this month, and it's so beautiful to have seen the second month of 2025. It's by the grace of God, and we're so delighted to be here and just talk about our health. We say that Afya Clinic is where we talk about everything health. So karibu sana, we're going to be here mpaka pale 10 in the AM. My name is Rachel Kahogo. I am extremely delighted, as I've said. Now I'd want to know how your week has been. What are you thanking God for? And of course, unatuwatch kutoka wapi? Unatuwatch na kina nani? And our numbers are very open for that. That is 0721 105 105 on WhatsApp and normal SMS. And then you have an SMS code which is absolutely free of charge, and that is 23814. 23814. Okay? And then we're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. Please feel at home. This is the place to be. Talk to us. We are very ready to read your feedback, very ready to hear from you, and to be having an amazing conversation. Okay? Now, last week on Afya Clinic, we were right here talking about fibroids. You asked so many questions, you were able to answer them. At the end of the show, we gave you the number, we gave you the location of Dr. Wekesa, and we say that if you have any question, please feel free to reach out. Ndio usaidike, because that's very important. And after that, you said that no, hatujamaliza hii conversation. We want to talk about cysts and know the difference between cyst and fibroid, which was already explained, but you said you want to know more about cyst. We also say that it's very important for us to talk about PCOS, which was really mentioned last week. So we'll be talking about that today, because we say that you are our guest of honor. So whatever you want us to talk about, we will surely talk about that. So today, we'll be having this conversation with an amazing lady who is not only a gynecologist, she's also a lecturer, and she's one of the best, not only in Nakuru, but in Kenya. Okay? And kama amekufunza at some point, pia tuambie. Sawa sawa. So today we'll be talking about cysts, we'll be talking about PCOS. So if you have anything around that, please feel free to text us. We've already told you our numbers, so we'll be getting back to you. Also, it's very important for me to say that because we've given you our numbers, please text us on WhatsApp or SMS. We'll be able to get your feedback. Please don't call for now. We can't peek while on air right now. So please text. We'll be able to get your feedback on WhatsApp, normal SMS. You can text on our SMS code. You can text on our Facebook page, on our YouTube page, but of course on all social media pages. Ukienda pale utafuti Rachel Kahogo, I'll be able to get you feedback. Okay? Now, officially, karibuni sana ndani ya Afya Clinic right here on MBCI TV, where we transform lives by the grace of God. Your host today will be Rachel Kahogo, and our amazing guest will be Dr. McKenna. Now, I want you to get to know who Dr. McKenna is. So let's get the guest profile.
Today, we are honored to host Dr. McKenna Dorothy, a highly respected obstetrician and gynecologist dedicated to women's health. Dr. McKenna currently serves at Level 5 Hospital in Nakuru and is also a lecturer in reproductive health at Egerton University. With a deep passion for her work, she is well versed in all gynecological matters, making her one of the most sought-after specialists not just in Nakuru but across Kenya. Her vast experience includes working with Aga Khan University Hospital, further solidifying her expertise in reproductive health and gynecological care. Join us for an insightful discussion as we explore key issues in women's health with Dr. McKenna Dorothy right here on Afya Clinic. Stay tuned.
All right, we are back. This is Afya Clinic, and that is exactly who Dr. McKenna is. And as you've seen, she's not only a gynecologist, she's also a lecturer, which is very interesting because last week you were talking about on Friday, last week on Friday, you were talking about tutoring and how interesting that can be. Yeah, so please feel free to send in your questions. We'll be getting into this conversation to pick your story. We let you know about everything that you need to know about cyst, ovarian cyst, and PCOS. All right, Doc, karibu sana.
Asante.
How are you doing?
I'm well, thank you.
How have you been?
I've been well.
Okay.
The year is moving so fast. I can't
It's
imagine.
moving so fast.
It's already February
Imagine.
2025.
Imagine.
Yeah.
Imagine. But we truly thank the Lord that we are finally here, the second month. Unajua tusema January iko na siku 60. So kuisha tu hivi we're like, finally it's Feb.
Yes.
Let's see how that goes. But we're very glad that you're here with us today to talk about PCOS, to talk about cyst, which is a really question of concern from the discussion that we had last week. So we're hoping that we'll be able to get a good flow of discussion for these. But even before we get there, apart from being a guider, you're a lecturer at Egerton, right?
I'll explain a bit about that.
Okay, tell us about it.
All right, my name is Dr. Dorothy Makena Kagia. I'm a gynecologist in the city of Nakuru, formerly a lecturer at Egerton University.
Okay.
But teaching is still my passion. Yeah, right now I'm into practice in other areas.
Okay, okay.
But I'm practicing obstetrics gynecology in Nakuru City.
Okay.
Yes.
How is it tutoring? You know, we had that discussion here about how tutoring is a calling. You can't just be a lecturer or a teacher just because. So what would you say about that?
Yes, I agree with you, Rachel. I think tutoring is a calling. I didn't know I had it until I got the job to be a lecturer. Okay. And then when I got into it, I discovered it's something I really enjoy doing. I enjoyed interacting with the students, passing on knowledge. Mentorship is a big part of something I love doing. Okay. So teaching and lecturing, quite a fulfilling career. Quite a fulfilling career, kabisa.
Amazing. Yes. Amazing. You know, that's good news to someone who wants to pursue that. So if you feel that's your passion, please go for it. Tumeshaambiwa na Dr. Makena that it's something good to pursue. Yeah. Yeah? Now, today we are talking about ovarian cyst and PCOS. But let's start with PCOS. Okay. What is PCOS in layman's language?
Wow, PCOS is one of those, I'd say it's a complex entity, even for the medical personnel to understand, but today I'll really try and break it down. Okay. So PCOS basically stands for polycystic ovarian syndrome. Okay. So anytime in medicine you see the word syndrome, syndrome means there are a number of symptoms which when you put together, it becomes a syndrome. Okay. So therefore, polycystic ovarian syndrome is encompassed by, with a number of symptoms which I'm going to mention. Okay. So this will be patients who, one will have menstrual irregularities. That means they have irregular periods. These are women who have very few periods, less than 6 or 8 periods in a year. Ideally, you know, a woman should have a period every month, but these are the ones, their cycles are much longer. It takes a long time from one period to another. For some, they say they can skip a month, 2 months, 3 months, even up to 6 months without a period. So menstrual irregularities is one of the components of PCOS. Okay. And that would mean very long cycles, like it takes a long time before you get another period, or another way to define it will be very few menstrual periods, less than 6 to 8 in a year. So that's number one. Okay. Number two, the other feature that makes that syndrome is features of elevated male hormone. So in females, we have the hormone estrogen and progesterone. We also have a small dose of something called testosterone, but testosterone is predominantly a male hormone. Yeah. So in PCOS, you have the ovaries producing a higher amount of testosterone. So they have a higher levels of testosterone. Okay. So these high levels of testosterone, they are responsible for these features, which include acne. So you'll find these ladies, they have a lot of acne, they have struggled with it, breakouts, very bad ones. Okay. So acne because of the high testosterone levels. The other thing is what we call hirsutism. And what hirsutism is growth of hair in the male pattern. For example, you'll find a lady with some hair on the face, on the chin, or even on the sideburns, or even on the upper lip. Okay.
And even on the chests, it depends on how severe it is.
Okay.
Or even on the abdomen, just some increased hair growth, thick, dark hair because of the high testosterone levels.
Okay.
The other symptoms that comes with high testosterone levels then is balding, can get a bit of hair loss, balding, and all that.
Okay.
So that's the second part. There are three things. So the last one is on ultrasound, you'll find small cysts on the ovary. So in summary, there are three things that make up this syndrome. One, irregular menstrual cycle. Two, you have features of high male hormone.
Okay.
And three, you have small cysts in the ovary.
Okay. So which is caught during the...
Which is caught during an ultrasound.
Oh,
that is only seen on ultrasound, yes.
Okay, okay. Maybe let's go on the first one.
Yes.
So you've said someone who has PCOS will have irregular periods. So what is the downside of that, of having irregular periods? Does that mean they'll be less fertile? Does that mean PCOS affects fertility? Yeah?
Yeah. That's a good question. So basically, these ladies who have the irregular periods, one of the main problems, the reason they have that irregular periods is because they don't ovulate. There is no ovulation. So in a normal menstrual cycle, it should be that the hormone estrogen is produced, then one follicle or one egg grows big and it's released and ovulation occurs.
Yeah.
However, in PCOS, you have small follicles. Many of them, none of them really grows big to be released and ovulated. Okay. All right? Okay. So these patients do not have ovulation. So they have what we call anovulatory cycles. Okay. So it's a cycle, but there's no ovulation. So by all means, that will affect fertility. Yeah. So one of the other challenges they come in to us with is it's taken, you know, a year of trying and you're not conceiving. And basically, you know that the underlying issue is that there is no ovulation. Okay. And there are treatments which are now can be given to help this woman to ovulate and therefore be able to sire a baby. Okay. So that's one of the ways it affects the health of this irregular periods affects the health of this woman. Okay. The other way is because there is no ovulation, it affects the womb. So in the womb, there's the lining of the womb. It's called the endometrium. This endometrium keeps growing every month, and at some point it's shed off in a period. So because there are no periods, this endometrium keeps growing and growing and growing. Okay. So they're at risk of something we call endometrial hyperplasia, just an overgrowth of the endometrium. And that is a risk factor even in future for something called endometrial cancer. Okay. Yeah, so PCOS is a risk factor for endometrial cancer. And that is because the lining of the womb just keeps growing, keeps growing, keeps growing. Okay. Yeah. Okay. And that's also, it's the reason why they get very heavy period. It might take months before the period comes, but when it comes, you can imagine this lining has really built up. Yeah. So there's a heavy menstrual bleeding. Okay. So those are some of the effects of this irregular period. Yes.
And is there something you can do when you're not getting the periods that, you know, would reduce the overgrowing of the endometrium wall?
Yes, 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 yes. When you see your doctor and maybe a diagnosis of PCOS is made, and maybe even when we do that ultrasound we do, and we see those polycystic ovaries, in addition to that, we could also see that the lining of the womb is quite thick, thicker than is expected to be. So there are some medications you're given. Basically, it's called progesterone. Okay. So the problem is that this lining is under the effect of estrogen, and there's no progesterone in a patient with PCOS. Okay. So the treatment would be, we give this patient progesterone, and it helps to thin out that endometrium. And it also protects this woman from endometrial cancer, which I've talked about. Okay. So progesterone becomes the main treatment for this overgrowing lining of the womb.
Of the wall. Okay.
Yes, if I would put it that way.
Okay. Now, the second symptom or the second cause that you've said that someone would pick the symptom that someone would pick from PCOS is that the testosterone would
it's elevated.
It's elevated. Now let's start with it's mostly a hormone in men. Yes. Why do ladies need it? What's the use of this particular hormone in ladies?
Yeah, so even ladies have, as I mentioned earlier, even ladies, normal ladies with a normal cycle have small amounts of testosterone. Yeah. It's actually produced in the ovary. though predominantly in a female, you'd have estrogen and progesterone. Those are the predominant hormones, but small amounts of testosterone are there. They're important for things like sexual function, libido, and all that. Okay. God in his mastery knew that it's an important hormone. Okay. So it has a role. It has a role, mostly a sexual function role. Okay. Yes. Okay. I didn't get the other part of the question. What did you say?
It's just that because most of the people would wonder if it's a hormone that men need. Yes. Why then is this that even in normal ladies we have a small level of testosterone? Yes, but as you've explained, it's very important. But when it's overproduced, now that becomes a problem.
Then that you get the symptoms.
Okay. Yes. So is there a way of, when you as a doctor realize that the testosterone is being overproduced, is there a way of reducing the production of that particular hormone? Yeah,
now we are delving into like the treatment of PCOS. Yes. One of the mainstay medications or treatments, if any person has had PCOS, I'm sure their doctor has mentioned this because it's one of the main treatments that we give, is the combined oral contraceptive pill. Okay. The one that normally we use for family planning. But for these patients, we would prescribe it as treatment. So what that does is that you're taking in some estrogen and some progesterone. And just to simplify it, it's just like to balance these hormones and restore the normal hormonal profile of a woman. So the combined pill is good. It reverses the hormonal imbalance that comes with PCOS. Okay. And it also reduces the testosterone levels. It does. There are some specific types of the pill which actually have anti-testosterone effect. Okay. That is to mean they work against that testosterone. They bring it down and reduce its effects. So when the woman is put on it, if they had this facial hair, it goes away. If they had this acne, it clears and their face becomes clearer. And then now their periods now become very regular. Every month they get a period. So there are medications for that. Okay. Yes. Okay. Now that's good news.
Now, who are the kind of ladies or who are the women who are most at risk of getting PCOS?
I would say there is a genetic predisposition to it. So you'll find that if they are in a family, you'll find that the sisters in that family, the mother, maybe the aunties had that. So there's a genetic predisposition to it. Okay. However, beside that, there is environmental predisposition to it, especially with a sedentary lifestyle and all that. Yeah, because you'll find that a lot of PCOS women will also tend to struggle with obesity. It can be that the PCOS causes the obesity, or even the obesity predisposes this person to this PCOS. Okay. Yeah, so those are the two that I would mention. It's still something not very, very well understood to explain that this particular reason causes PCOS. Okay. But genetically, there are just some people who are just predisposed to it and they're at risk of it.
All right. Yeah. I know we'll be getting into ovarian cyst in a very short while, but there's this question that keeps coming up when we talk about PCOS, is that what's the difference between PCOS and ovarian cysts?
All right. I think those are two very different entities. All right. PCOS, as you've said, is an underlying hormonal problem, a hormonal imbalance because of just this extra production of testosterone. However, when it comes to ovarian cysts, it has no hormonal predisposition. It's not a hormonal problem. So when you look at the structure of the ovary usually has this small follicles. They're called follicles. Those are the eggs, basically, if I would put it in layman's. So the ovary has eggs. And every cycle, the egg would grow. And as I said, in a normal cycle, only one would grow bigger and become ovulate and be released in what we call ovulation. So sometimes during this normal ovarian cycle, you can find that when this one becomes big, instead of shrinking back or going away, it persists a bit longer. And so when you do an ultrasound, you'll be told, hey, there's an ovarian cyst. Sometimes after it's released, what is left behind is something called a corpus luteum, and it's supposed to go away on its own. Sometimes it does not go away, and it persists a bit longer. And then you'll be able to pick it on ultrasound, and you'll be told you have an ovarian cyst. So just to say that most cysts that we see are part of the normal physiological process of the ovary. They are not harmful. and they'll tend to go away on their own. You don't even need to do anything about them.
Okay.
So you'd see that ovarian cysts could be part of the normal physiological process of the ovary of a normal woman.
Yeah.
But PCOS then is an underlying genetic hormonal problem going on at the ovary, which has many other side effects apart from just the small cysts in the ovary.
Okay.
Yeah.
I see. And now, can PCOS go away on its own?
That is a question that we get asked a lot.
Yeah.
What can I say? Do I want to give a yes or no answer? All I can say is that there are some treatments someone can be put on to just reverse the underlying problem, which is the hormonal imbalance.
Yeah.
As I mentioned, the pill, and there are many others. So we can only say we are able to reverse the effects of PCOS, but completely cure it, Kidogo,
yeah,
not yet.
Yeah.
Not really.
Okay.
But the symptoms could improve over time or could get worse over time. It again depends. Different people have different, the way the disease goes on.
Okay.
Yes, but that said, most patients with PCOS lead a normal life.
Yeah.
Like any other person. Yes, and they are able to do that.
Okay.
And they're able to get children, most of them.
Yeah.
Only a few would have maybe a bit more challenges, but most will be able to to lead a normal life.
Okay.
Yeah.
Because the issue of fertility, getting kids, comes up sana with the topic, PCOS. Now my question would be, for a patient who has PCOS, they get kids or wapate a kid the first time. Will the cycle go back to normal? Will that balance their hormones? Even after that, they'll have to continue with the treatment of PCOS. Is it something that gets better after you've been able to conceive your first baby?
Yeah. Medically speaking, there is not much effect of of giving birth and its effect on PCOS.
Okay.
It's not something that is known. I can't say that once you've given birth, then PCOS can go away because of that. Yes. Okay. It is something that is can still even continue even after giving birth. And there are women you'll find that maybe to conceive their first child, they needed some medication to induce ovulation. As I told you, ovulation does not happen in PCOS. And you'll find that maybe even in the second one, they could need. And even in the third one, they could still need. However, that said, there are still those again who most patients with PCOS don't need medication to conceive.
Okay.
They're still able to, once in a while, they just ovulate on their own and they're still able to conceive naturally. So not just a few would require treatment to actually conceive. Yeah.
Okay, I see. Now, we'll be getting this particular segment where we talk about everything health. It's called Healthy Living by the one and only Sylvia Wanja. But before we get that, I see we have so many questions coming in, and we'll be coming back to answer all of that. Just to remind you, our numbers are still very open. That is 0721 105 105 on WhatsApp, and of course normal SMS. And then our SMS code, which is absolutely free, is 23814. 23814. That is our SMS code, which is absolutely free. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. So on those two platforms, you'll be able to get us. Ujumbe wako pale on the comment section, tutakuwa tupata loud and clear. And of course on all social media pages, ukienda pale at Rachel Kahugo, I'll be able to get your feedback as well. Now let us get Healthy Living by Sylvia Wanja, and then we'll be coming back. Tukirudi, we'll be coming to go through your questions, and then we'll be continuing with that discussion. Na naona kuna maswali mingi pia ya cysts. Don't worry, we are coming there. All right? For now, let's get Healthy Living.
Hello and welcome to Healthy Living. My name is Sylvia Wanja. Today we are going to talk about managing PCOS and ovarian cysts. Managing polycystic ovarian syndrome, that is PCOS, and ovarian cysts involves a combination of lifestyle changes, medical treatments, and regular monitoring. Both conditions are related to hormonal imbalances that affect the ovaries and can lead to a variety of symptoms such as irregular periods, fertility issues, and cyst formation. Here's how to manage them effectively. Number 1, adopt a healthy diet. Balanced diet. Focus on a nutrient-rich diet with plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Low glycemic index foods.
Choose foods that have a low glycemic index, such as whole grains, legumes, and non-starchy vegetables to help manage insulin levels, which is important for people with PCOS. Manage weight. If overweight, losing even a small amount of weight can help regulate periods and reduce the risk of further complications. Anti-inflammatory foods. Incorporate foods like fatty fish, nuts, seeds, and olive oil to reduce inflammation, which is often present in PCOS. Number 2, regular physical activity. Exercise regularly. Aim for at least 30 minutes of moderate exercise most days of the week. Activities like walking, jogging, yoga, swimming, or cycling can improve insulin sensitivity, reduce symptoms, and support weight management. Strength training. Include strength training exercises twice a week to build muscle mass, which help regulate blood sugar levels. Number 3, monitor and manage ovarian cysts. Regular ultrasounds. If you have ovarian cysts, regular monitoring via ultrasounds can help track their size and prevent complications. Pain management. Over-the-counter pain relief such as ibuprofen can help manage mild pain caused by ovarian cysts. However, consult a healthcare provider if pain is severe or persistent. Watch for complications. If cysts rupture or cause torsion, that is twisting of the ovary, immediate medical attention is needed. Surgical intervention. In cases where cysts are large, persistent, or causing significant symptoms, surgery may be required to remove the cysts or, in some cases, the ovary. Number 4, addressing emotional well-being. Stress management. Managing stress through yoga, meditation, or relaxation techniques can help with hormone regulation and overall well-being. Therapy and support groups. The emotional impact of PCOS and ovarian cysts can be significant, so consider seeking counseling or joining support groups to manage the mental health aspects.
So that's it on healthy living with Sylvia Wanja. Now let's get to hear what the doctor would say about that particular segment. What do you think? Especially about diet. What?
Yeah.
Okay. Mm-hmm.
Yes. So when you're managing PCOS, one of our first line treatments is actually lifestyle modification. And that video was quite on point about it.
Okay.
And that is just because if you advise a woman to lose 5% of their weight, for example, if they were 100 kgs, they lose 5 kilos and become 95. That only would just restore back their hormonal balance and would be able to restore back their ovulation. And they could even actually conceive just from weight loss.
Okay.
So weight loss is very, very important. So then a healthy diet and regular exercise become very, very important.
Okay.
Yes.
Okay.
Especially to also help them to conceive.
Okay.
Yeah.
So what happens for someone who doesn't really need to lose their weight, for someone who's on their correct BMI and they still have PCOS?
Those ones, they tend to have better chances even of ovulation.
Okay.
It's better when you compare someone with a normal BMI against someone who is overweight or maybe obese.
Okay.
Yes. What I would tell them is still maintain a healthy lifestyle. Still very important.
Yeah.
For your general well-being.
Okay.
Yes.
That includes exercising, as you said, and yoga and all that.
And and diet.
And diet. Okay.
Just to add that there's a very strong link between PCOS and diabetes.
Okay.
Yes, because even as you heard in the video, one of the hormones again that has a problem is insulin. We need insulin in our bodies to be able to regulate our sugars. So in patients with PCOS, they have something we call insulin resistance. It's the same thing we see in patients who have type 2 diabetes.
Okay.
Yeah, so even patients with PCOS, we actually keep monitoring their sugars because we know that they already have a risk of having type 2 diabetes. Okay. Yeah, I thought I should mention that.
Yeah, that's very important. And I said, now we'll go to the topic cyst because I see we are having questions that are coming in about cyst. Now, for someone who's maybe just joining us, what is ovarian cyst?
Now, ovarian cyst, again, away from polycystic ovarian syndrome. Ovarian cyst. Ovarian cysts are just small growths on the ovary. They are mostly filled with fluid. So just say it's a growth on the ovary that's a fluid-filled sac or growth on an ovary. Basically, that's what a cyst is.
All right.
Yeah.
Is it cancerous?
The good answer to that is that most of them more than 90% of them are not cancerous. The ones that cause concern are a very small percentage. And that we'd worry about those in the older woman. The older woman, maybe around menopause or after menopause, and they have these big cysts, then those ones would be more concerned about the risk of them being cancerous. But in this woman of the reproductive age, before menopause, most of them are just what we called physiological cysts. They are part of the normal ovarian cycle. Sometimes a cyst persists, and you don't need to do anything about it. If you give it time, about 8 to 12 weeks, you come back again with a scan, you find the cyst is gone.
And is it harmful?
Cysts, what can I say? They can cause symptoms. So the harm would be in form of symptoms, especially if the cysts are big. So if you have big cysts, especially those which are more than 5 centimeters, sometimes they can cause symptoms. Symptoms would include some pain, some abdominal discomfort on one side of the abdomen. The side of the abdomen that's affected, either on the right or the left. So you could have some dull pain. Sometimes if the cyst is so big, sometimes it can be bigger than 10 centimeters. There's a risk that it could twist on itself because the ovary now becomes heavy. So the cyst could twist on itself and cause something we call an ovarian torsion, where the ovary has twisted and sometimes it can cut out its blood supply. And that becomes an emergency, and that would require surgery to untwist it, and sometimes if it's too late and the ovary has died, to actually remove the ovary. So if they are too big, they can be harmful in the sense that they can cause symptoms, and that would be pain, or if they are too big, they can even turn on themselves. Sometimes they can just rupture. Most of the times they rupture and you don't feel anything, but sometimes they can rupture and someone just gets this sudden pain, especially if it has ruptured and it's bleeding. And those are the cysts that might require some surgical intervention.
But normally it doesn't cause so much harm.
Normally not much harmful.
Now we're talking about ovarian cysts, but is there any other kind of cyst? Because we've narrowed it down to
the
ovarian cysts.
A cyst, basically, as I defined it, it's a fluid-filled growth. It can occur anywhere in the body. A cyst can occur anywhere in the body. You can get a cyst on your skin, can get a cyst in the brain, can get a cyst in the eyes. It can occur anywhere. Only that now when it occurs in the ovary, then we call it an ovarian cyst. But cysts are not limited to the ovary only. They can occur in any other part of the body. Yes.
And is this ovarian cyst any different from these other kinds of cysts?
Could be kind of different because of how they come about. As I said, most will come about from the normal cycle, the ovarian cycle. Or rather the menstrual cycle, as the egg grows and then it's released. So most will occur following just the normal cycle. Unlike in other parts of the body where there is no cycle going on, so it could be other things that are causing the cyst to occur. So that's how they'd be different. But how they look like, it's just a sac, and when you pop it, it's just fluid that comes out of it. However, let me just add something. On the ovary, apart from this physiological cysts that are the most common that we've talked about, there are many other types of cysts. Some are more rare than these ones that we've talked about. There are those which occur in the younger girls. Even small girls, you can find them, and they start occurring even when the ovary is being formed in the womb, and it's a developmental problem. And they have a cyst. Specifically, it's called a dermoid cyst or a teratoma. So those ones, you can find them in the younger girls or in the girl in the 20s or the 30s, and they tend to grow very big. They are not cancerous as well. The very weird thing about them is that when we remove them inside, you can find hair, you can find some fat tissue inside, you can find teeth.
Really?
You can find a lot of tissues. It's an embryo. I don't know how to break it down, but it's an embryologic problem. Just embryology when the ovary was forming. And so you get all these derivatives of many organs in those cysts. Most of them are not cancerous. And there'll be the common cyst in the young girl, maybe the teenager who has a big cyst. And there's a way they look on ultrasound. So even the ultrasound person will tell you this is likely to be a dermoid cyst. Most of them require surgery to remove. Those ones don't resolve on their own.
But you say that's very rare?
It's a bit rare.
But so what's the cause of that? what would be the cause of that? As much as it just occurs, is there something you can pinpoint that this could be the cause of that?
It's something that you trace back to, there's something we call embryology. So basically, when fertilization occurs, let me take you back. Okay. We usually form some 3 layers. When it's microscopic, you can't even see. We form some 3 layers. One is called ectoderm, mesoderm, and endoderm. From this, you derive all the organs in the body. Okay. Yeah. So, for example, from the ectoderm, you get the skin, you get hair, you get all that. From the mesoderm, you get your muscles, you get your bones, and all that. From the endoderm, you get your internal organs. You get your liver, your spleen, your heart.
That's very interesting.
Yes. Yeah. Okay. So what happens, this ovarian cyst you have, in this dermoid cyst, you have the 3 layers are somehow incorporated, and therefore you get products from all the 3 layers. That's how you end up in this cyst finding a derivative from the ectoderm. So that's why you find some hair. Hair is an ectoderm derivative. You find some what else? Some fat tissue. You find some teeth. You find different tissues. Okay. You can find inside there. Okay. That's the only way I can explain it, because there's no way to understand it unless you go back to embryology. Embryology. How it develops.
Okay. Yes. That's very interesting.
Yeah. So mtu asiseme amerogwa, eti nilitolewa cyst, iko na meno, iko na nywele. It is something. It is something that is known, and it can happen. Okay. Yes. And it can be treated surgically, and it's not cancerous.
That's a good thing. Yes. That's a good thing. So it is not cancerous. Now, we'll be going to more questions, but let's get to read some of the questions. Asema, hello, good morning. I'm Darling from Kiricho. I recently went for scanning, and I was told that I had a cyst, and all of a sudden, pregnant. So my question is, will the cyst affect my baby? So does a cyst affect the pregnancy?
Yes.
In any way?
All right, that's a good question. What I can say, in the very early stages of pregnancy, it's not unusual to find a cyst. You'll find, when you do an ultrasound, there's a baby growing in the womb, and on one side of the ovary, there's a cyst. Why does it occur? Remember, when a normal ovulation occurs, there's a cyst left behind after the egg has been released, and it went and got fertilized and became a baby. In the ovary, there's a cyst that was left behind. It's called a corpus luteum cyst. It's a very important. What does it do? It produces progesterone, which supports the pregnancy. So it's that cyst that supports the pregnancy until the placenta is formed. Then the placenta takes over. So when you come in, we see you're pregnant, and there's this cyst. It's about 3 centimeters, sometimes 4 centimeters. Most likely it's a corpus luteum cyst. Nobody should touch it. You could touch it, and then you get a miscarriage because of that, because you've removed the support of that pregnancy. Okay. So it has a role. It produces progesterone to support the pregnancy. Okay. So it's an important cyst. It's important for that pregnancy.
All right.
Yeah,
all right.
It's supposed to be there.
Okay. And now, generally, apart from that kind of cyst, which you said is very important, and then the other one, which is actually very rare, as you said, who are the kind of people who are at risk of getting ovarian cyst? Is it a specific age group, or is it everyone who is fertile?
Any woman of the reproductive age can get a cyst.
Okay.
Whether or not they have predisposition, or the common cyst, the physiological one, any woman can get it. That is because there is a cycle going on in their ovary, and some cycles the cyst will persist, some it will go away, so it's not unusual. So I would say that any woman in the reproductive age group, that is from when you start menstruating until you reach menopause, that age can get a cyst. Most of them are simple cysts. Okay. Yes. Okay. However, when you go to now the rarer types of cysts, there are women who have conditions like endometriosis. Endometriosis, again, is another big subject. But just to break it down, what endometriosis is where the lining of the womb, which is called the endometrium, you find that tissue outside the womb. So if you find it in the ovary, that endometrial tissue on the ovary, it can cause a cyst in the ovary. And that is usually called a chocolate cyst. Actually, when we do surgery and when you open it, some chocolate fluid comes out. It's just endometrial tissue because some bleeding was going in there. The same thing that goes on when you're menstruating was going on there in that ovary. So I would say that patients with endometriosis are at risk of some type of cysts, and these are those chocolate cysts, or what we call an endometrioma.
Okay. I see.
Interesting.
Very interesting. Very interesting. Hi doc, I'm Miriam from Nairobi. I'm a diabetic patient. I conceived in 2019, but my baby died. From there up to now, I have not yet conceived. I'm stressed up. Kindly advise me. I'm tested all the rest, but no fibroids, no cyst, no nothing. What would be the problem? I think I may test for cyst, I may test for fibroids, it's negative. So, but she's not able to conceive, so what would be the problem?
All right.
She's diabetic.
Yeah, she's diabetic.
Yeah.
Okay. That may be someone who would want to be seen, because there are a lot of questions you want to ask there. One, how is your cycle? You know, again, as I mentioned, if you have these irregular cycles, then it already hits us that the problem could be you're not ovulating. All right? So we want to evaluate, is this woman ovulating? Because you must ovulate to get a baby. Number two, there are other causes of someone not conceiving. We want to find out, are the tubes open? Even beyond fibroids and cysts that she has already checked. More importantly, are the tubes patent? And sometimes they could have been patent 2 years ago, and now something has happened and they are no longer patent. So there is a test to check for that. Number three, is the spouse checked? Because it takes two to make a baby. And the spouse contributes about 30–40% of the ability to make a baby. So you can't ignore that. So the spouse has to be checked, you know. Is there enough sperm count? Is it normal? Is it moving properly? Is it okay? So you need those baselines to be able now to pinpoint where the problem could be. But given that they had a baby before, I would encourage them to keep trying. They still should have a good chance that they should carry another pregnancy.
You've talked about the tubes being patent. So what would cause the tubes to be closed?
We have left the ovarian cyst discussion.
We are coming back there.
We are coming back. Okay, so the commonest thing that causes tubes to be blocked is there could have been an infection going on in the pelvis of that person. Specifically affected the tubes. You know, when you have an inflammation and when it heals with scarring. The same way if you get hurt somewhere, a scar will form. So even inside there, and you can imagine the tube is a very microscopic structure. So if there's any little scarring, it can just close. So infections are common, especially we could talk about sexually transmitted infections or any other pelvic infection that could have been there. And the problem with these infections is that most of the time they have no symptoms. And that's the interesting thing about it. 50% of women could have an infection going on and they don't have symptoms. But that doesn't mean it's not causing problems inside there. So the doctor will ask you, have you ever been treated for an infection? You say no, but that doesn't mean there was no infection there. Then we check the tubes, we find Allah, they are already closed. So that is one of the common problems, infection. Number two, if you have a condition like endometriosis, again, because what endometriosis does, you can imagine this endometrial tissue is outside the womb, so it's in the pelvis, it's causing a lot of inflammation, so you get a lot of scarring inside that pelvis, the tube anatomy changes, things are just stuck together, it again can cause. So she really needs to get checked. She really needs to get checked. A lot of things to really find out, to come to the conclusion of exactly what is causing her not to conceive. And nowadays the technology has really improved. We can have solutions to almost everything. And so she should be really encouraged. It can be that she should be able to. She could get pregnant. She has a good chance.
You'll get help.
Yes.
You'll get help.
Yes.
Asema, good morning, doc. Asema, would ovarian cyst cause infertility?
Ovarian cyst specifically, not necessarily. Mostly not. Mostly for those physiological cysts that you get someone just as a simple cyst. As I said, they are a sign that the ovary is there, it's working. There's an ovarian cycle going on. Unless you're talking about it in the aspect of polycystic ovarian syndrome, which you have said how it can cause infertility because there is no ovulation. But if they're talking about this just one cyst, a big, it's unlikely to cause infertility. Because it has no effect on whether the tube is patent. Remember, you need a patent tube, you need ovulation, and you need sperm to get a baby.
Okay. Yeah. So it doesn't really affect
not necessarily, unless in the aspect of polycystic ovarian syndrome.
Okay.
Yes.
Maybe on that, will it then affect your pregnancy in any way? Will it cause pregnancy complications?
Not really.
Okay.
Not really. Cysts are, they're just outside there. The womb is a very protected place. Once a baby has implanted there,
ako sawa.
ako sawa.
Okay.
They are well protected. Hata kama kuna cyst kwa ovary, it is unlikely to cause any harm.
Okay.
Yeah.
Okay. I see.
Unless they are very, very big, and we'd remove them because they are uncomfortable and they are causing the patient pain or discomfort, not because it will affect a pregnancy.
Okay.
Yes. Those are the times maybe someone would get it removed and they are pregnant. But most of the time, small cysts, 4 centimeters, 3 centimeters, you're pregnant. Just leave it.
Okay.
Yeah.
Now, let's see what we have. Someone who's talking about ovarian cyst. So let's hear what they have to say about that. So that's the vox pops that you have, and then we'll be coming right back to discuss a bit about that, and then we'll be taking a very short break. But remember, our numbers are still very open. That is 0721 105 105 on WhatsApp, and of course normal SMS. Okay, and then you're live on Facebook on MBC ITV Facebook page, you're live on YouTube on MBC ITV official YouTube page. You can always text us on our SMS code, which is 23813, and then we'll be able to get your feedback. For now, let's get the vox pop so that you would get to hear what people are saying about ovarian cysts.
Ovarian cysts, okay. First of all, I think you can look at it from the broader perspective. I think if you look at the vaginal canal, there are so many microorganisms there. Some are beneficial, some are very dangerous. It depends with how many are there. There is something in medicine that is called colony. When an organism colonizes some places, it becomes so serious and very dangerous. Something like a bacteria, if they colonize some places, they become so dangerous. So these ones are the yeast infections, we have the fungal infections, we have the bacterial infections, we have the viral infections, we have even the acidity or the alkalinity of the entire place. So it depends on several factors. So you can find when you have other microorganisms, and there are so many, that is where you come to a situation whereby you find you have this ovarian yeast.
So that is it, Doc.
That one is talking about something different. Yeah, it's talking about the vaginal canal or the birth canal. Yeah, in the way that it has, what he's saying is actually true. That is, it has a lot of bacteria. Some are very good, and they are just supposed to be there to cause that place to remain acidic and to remain healthy.
Okay.
He's not talking about this.
It's something totally different.
Totally different.
Okay.
Yes.
Okay, I see. So that is it. That's what you're getting from the people. We did ask about PCOS, but kidogo, most of the people really did have the actual understanding of PCOS. That's one of the reasons why we felt it was very important for us to talk about that as well, so that we would be having someone who's probably having all the symptoms of PCOS, but they really don't know what's going on. So if you have the symptoms that we just talked about, it's very important for you to go get checked. The good thing is that we've said there's help. There's treatment. So it's not such a big issue. When we were starting this conversation, people are saying that I'd rather just not know what's happening, rather than now realize I have to deal with something, take meds. Probably I'm dealing with something that would cause infertility, and that causes so much fear in people. But it's very important that we say that hizi zote ziko na treatment. Last week people were saying that apana, maybe did I just cyst ni cancers. So most of the people didn't want to know if they had cysts or not. But it's very important that you've talked about that.
We only worry about cyst. Again, let me just repeat, the risk of cancer, especially in the older woman, maybe above 40, and you 40, in your 50s. And then there are some ultrasound features. It depends again on how the cyst looks like. There's a way it looks like, and it tells us it's likely to be something very suspicious. For example, it's a very large cyst. It's affecting both ovaries. It has this thick wall. It has these divisions and septations. There's a way it will look like on ultrasound. Okay. And those are the women we want to do additional tests and find out what is the risk that it is malignant. So there's a blood test you can do. It is a marker of it's a marker of malignancy. It's a marker of cancer. Okay. So there's a cancer marker for ovarian cancer. It's called CA125. So for the older woman who have a cyst that is just not a simple cyst, it looks suspicious, we always have to do that marker. Okay. And so that then if it's high, then now we are able to manage accordingly and actually find out for sure whether it's cancerous. Okay. Because ovarian cancer is rare, but it's very devastating. It's a very devastating condition. Okay. Yeah. Okay. I hear you. So we have this person saying that I had an ovarian cyst and it was cancerous. So the left ovary was removed. Could that be the cause I'm not able to? Could that be the cause I'm not able to get female children? So it means you have boys. Yes, there are times you could lose the whole ovary, like this particular patient. And that means God was genius to give us two. You have to. Should be able, and for sure she has conceived, she has children. Yeah. So the other ovary should be able to work and you should be able to conceive. Is it the reason you don't have boy children? Not really. Whether you had, if you had two ovaries, it's possible you could still have gotten the same children. Yeah. So it has, you can't say one ovary keeps boys, the other ovary keeps girls. That's a lie. Yeah. Yes, it depends on that fertilization, whether it was fertilized by a Y or an X.
Okay, I see. Now we have someone who's been asking about the ovulation as well. Let me just get it. Anasema, hi Rachel, please ask Dr. Dorothy, why do I experience pain during ovulation and it's only on the left side?
Yeah, so sometimes you can experience pain during ovulation. It has a difficult medical name, I will not mention it. But it's an ovulation pain. It occurs mid-cycle, especially if you have a regular cycle. You would actually know today ovulation is occurring. Yeah. So a certain percentage of women get that kind of pain, and it's a good sign because it's a marker of ovulation. Yeah. Yeah. Can be quite severe sometimes, and just relieved by over-the-counter painkillers, just some paracetamol, some ibuprofen, some brufen. You know, will just sort out that pain. Okay. On the left only. For most women, they'll say it alternates. This time they felt it on this side, the next time they felt it on this side, depending on which ovary ovulated. Yeah. So for her, it's interesting that she only feels it on one side. But all we can say is that she's ovulating. Okay.
And why is it that for some ladies, they feel the pain during ovulation? For some women, they just don't know when it happens.
Most actually don't know when it happens. Most. The ones who feel are very few. Okay. Yeah. It just depends. Ni maumbile tu. It's and again also pain threshold. There are those ukiguza hivi kidogo they feel the pain. Yeah. You need to hammer something for them to feel something. That could also play a role. Okay. But you can imagine for the egg to be released, it has to break open from that. Yeah, from where it was. It has to break open for it to be released. So that can cause pain. Okay. For most patients, for most women, they're not supposed to feel it. But for a few, they feel it, and that's okay.
That's just it.
It's a normal
It doesn't mean that there's anything wrong happening.
It's a normal thing.
Okay. So, kwa sawa. Don't worry.
Sawa.
Yes. Asema, good morning, Kahogwen Doc. And Uliza, are there particular medicines that can increase the chances of getting ovarian cysts?
Particular medicines that can increase chances of getting ovarian cysts? Yeah. None that I can think of. Yes, I could think of something. Yeah. For these women maybe who already have a problem with conceiving and now they have been put on something we call ovulation induction, and it's basically what that is, inducing ovulation. So what you're doing is like you're causing this ovary to grow some eggs, some follicles, and release them. Sometimes it can grow more than one or two, and you can find there are very big follicles there or cysts. So patients on maybe medications like ovulation induction could get some cysts. Okay. On the contrary, there are some medications that reduce the risk of someone getting cysts. On the contrary, on the flip side. Okay. So for these patients who keep coming with cysts, you could put them on the combined oral contraceptive pill again. And what that does, it doesn't cure the cyst that is there, it just prevents new ones from developing.
I see.
Yeah, so it's not unusual to hear patients, I had a cyst and my doctor prescribed the pill. And just for the audience to understand, the pill is not to cure the cyst that is there, it's to prevent new ones from forming. Because what the pill does, it inhibits ovulation, so it stops that cycle in the ovary.
I see. So it's a balance there. Perfect. Now, we're taking a very short break. It's already top of the hour. It's 9 a.m. So we're taking a very short break and then we'll be coming right back. Remember, today we're talking about ovarian cyst and PCOS. So if you have any question around that, please send in your question. We'll be able to get it. For now, let's take a very short break. We'll be coming right back.
MBCI Television, transforming lives.
Pray for the nation to which I have carried you into exile, and our nation to God. From Friday 7th February at 5 a.m. running till Saturday at 6 a.m. Believers from all walks of life will gather at the Harvest Cathedral inside Kingdom Seekers Fellowship Nakuru. Responsibility. It is God who made every nation and determined the places where we were born on the face of the earth, and appointed times and boundaries for our habitation. Be a patriot. Be counted among over 1 million intercessors standing in the gap for the nation in prayer. Join us for 25 hours of worship and intercession, an interdenominational gathering, free and open to all. Pray for Kenya, for when our nation prospers, you too shall prosper. Are you ready for the Impartation Dominion Conference at Kingdom Seekers Fellowship, Thika Road, Clay City, this February 13th to 16th, 2025, for a powerful encounter with God, hosted by Pastor Essalom and Julia Karanja.
Your level of understanding is the one that determines the level of your possession. Only you can receive the light from the word of God, you can change your destiny.
Theme from Genesis chapter 1 verses 26. This life-changing gathering will ignite your walk with Christ, inspire spiritual dominion, and equip you to fulfill God's divine purpose. Our special guests include Apostle John Kimani William, overseer of Kingdom Seekers Fellowship.
God desires that you may have dominion in your faith.
Apostle David Juma.
God has blessed every nation, and Kenya is also blessed.
Apostle T.M. Mwangi.
So ours is not intelligence only. Ours carries some level of life.
We are also honored to have Apostle Michael Orokpo from Nigeria joining us as a special guest minister.
I have the power to lay it down and to take it up again. That's dominion.
Expect impactful teaching, heartfelt worship, and fervent prayer as we pursue God's presence together. The conference is free and open to all. Join us live on Facebook and YouTube at Kingdom Seekers Fellowship, Thika Road. We look forward to seeing you there and sharing in this transformative experience.
Step into the digital world of tomorrow at Goshen Medical and Technical College's School of Information Communication Technology. In the fast evolving world of information and communication technology, our School of ICT is designed to match the speed. Whether it's mastering the intricacies of ICT, pioneering innovation in computer engineering, achieving digital literacy with ICDL, crafting stunning visuals in graphics and design, building networks in computer networking, or staying up to date with the latest Microsoft packages, we have a program tailored to your digital dreams. Our programs are designed to keep you at the forefront of technology. We offer certificate and diploma courses in ICT, empowering you to choose the path that fits your tech-driven career. career goals. A minimum grade of C- or higher is required for diploma courses, D plain or higher for certificate courses, and D and below for artisan courses. We also offer bridging classes for English, Kiswahili, Biology, Mathematics, Chemistry and Physics, allowing you to choose the path that fits your career aspirations. Visit our campus today or call us at 0750 264 044 or 0723 047 468. For more information, check out our website at www.goshencollege.ac.ke.
Welcome to Goshen Medical and Technical College, Pcos.
MBCI Television, transforming lives.
All right, we are back after that very short break, and of course we're here to talk about ovarian cyst and PCOS. This is Afya Clinic right here ndani ya MBCI TV ambapo tunabadilisha maisha by the grace of God. It's the 5th of February 2025. Yes, such a WhatsApp ama normal SMS, we'll be able to get your feedback. And of course, we have our SMS code, which is 23813, free of charge. You're live on Facebook, you're live on YouTube at MBCI TV. Ukienda pale tutaweza kukupata. And of course, on all social media pages, as Rachel Kahogo, utanipata pale. I'm your host today, and today we are having an amazing doctor who is Dr. McKenna. She'll be able to explain or answer all your questions, so please feel free. Now we'll be starting with Lydia ambaye anauliza, anasema, hi doc, mine is 4 centimeters at the right ovary, can it be healed? It's an ovarian cyst.
Yeah, again, as we said, most cysts are, number one, not cancerous.
Yeah.
4 centimeter cysts, most likely it's a simple cyst. Let it be. Rescan in 3 months, chances are very good it will not be there. You only remove it if now by that time it's grown bigger, or it's now causing symptoms.
Okay.
Yeah, but most of the time it will have gone away.
Okay.
Yeah.
So inanga shida sana. Just need to keep checking. Okay. And when you realize you have an ovarian cyst, without taking medicines or medication, doing all that, if you just decide that I'll now just eat healthy, exercise, do what we said about your normal life, just improving how you live, will it also just disappear itself without medication?
Yes. Most of the time we don't give medication for a simple ovarian cyst. No.
Okay.
Yeah.
That's good news.
Yeah.
That's good news.
We just tell you come back in 3 months. We repeat a scan.
Okay.
Yeah.
So what would be the effects in those 3 months? Will you be seeing any symptoms?
Only if there are symptoms, mild pain, you can take a painkiller. But then we'd also caution you, come back, if the pain is getting worse, because maybe it has grown bigger and twisted on itself. You don't know that. Most of the time it doesn't.
Okay.
4 is a small one. The ones that twist are big, are very big ones.
Okay.
Yeah, so just manage the pain. Yeah, those which reach 10.
10 is really huge.
That's huge.
Yeah.
Yeah.
Okay.
It's like the size of your womb. Yeah.
That's huge.
That's huge. So those ones those are the ones you can advise, hey, this one we need to remove because it's very big.
Okay.
But those which are usually less than, some people say 5, some people say even 6, less than 6, simple cysts, just repeat a scan in 3 months.
Okay.
It will have gone away naturally.
Perfect. So you have someone who's saying that she has a problem with conceiving. She's asking what would be the problem. No details. She just said she has a problem with conceiving. Yeah. So what would be the problem?
Many things would be the problem.
Yeah.
Yes. So number one, this is someone I would want to know how old they are.
Yeah.
Age is a very strong factor when it comes to fertility. The older we get, especially beyond the age of 35. I'm not saying people over 35 will not conceive.
Yeah.
But medically speaking, the fertility curve starts dropping. So I would want to know how old they are. That tells me a lot. I would want to know how their cycle is. If they have a regular cycle, it tells me they are ovulating.
Yeah.
A regular cycle is a good marker of someone who is ovulating.
Yeah.
I would want to know Many other things. Are they on any medication? Have they had any surgeries before? Have they had other children before? Or they have never been pregnant at all? That also tells me something. And then I would also want to evaluate and find out, are the tubes patent? As we said again. Is the spouse evaluated? Yeah, so that person would need a proper evaluation to come down to the root cause. If the problem is ovulatory, we take care of it. If the problem is a tubal factor, we tell you what options are available. If the problem is a male factor, we tell you what options are available.
Now you've talked about, and you've said it so many times, regular and irregular cycles. What's a regular cycle?
Yes, a regular cycle. A regular cycle would be one that occurs every 21 to 35 days. So a cycle length that is normal is 21 to 35 days. So there are those every 21 days, those are the ones who get a period twice a month. Every 21 days, they're getting a period. This one, they are not many, but they have a short cycle and it's normal. Yes. The commonest people are the ones in the middle, 28-day cycle. So every 28 days, they get a period. After 28 days, they get a period. There are those it's 26 days, there are those it's 31, 32, up to 35. So anyone who gets a period more than 35 days after the previous one, that's what they are. It's like a marker of PCOS. Remember, they will get fewer periods in a year. It's a marker that maybe they're also not ovulating. Those again who get shorter than 21, there's a problem. So a normal cycle length should be 21 to 35, and most people will be around 28. Number 2, they will bleed for 3 to 8 days. Some people say 2. There are those who bleed for 2. It's still normal. So let's say 2 to 8 days. Most people will be again in the middle. It's a normal distribution curve. So most will be in the middle. They'll bleed for 3 or 4 days. But anyone who bleeds 2 days or up to 8 days, that's a normal period. Number 3, there should be no bleeding any other time. So if you're spotting in between the time you're not on your menses, there's a problem and that should be checked. It's something called intermenstrual bleeding. Bleeding in between menses. That should also be checked. Number 3, the volume of the bleeding. It should not be a heavy period. And heavy is a bit subjective because only a woman will tell you, I feel this one is heavy. But one of the ways to say it's heavy is if a pad is soaking in 1 to 2 hours. Between 1 and 2 hours, it's soaked. So you can imagine in a day, 12-hour day, you've changed like, almost 12. That's a heavy period. And then if it's coming with clots, that's heavy. All right. So that's an abnormal period. So it should be moderate. Maybe 3 to 4 pads in a day for most patients. And with no clots. Then the last aspect of a normal cycle is the pain should not be, there's some pain, there's some discomfort, but the pain should not be this excruciating pain. You can't go to work, you can't wake up, you can't do anything. That's a problem. It needs to be checked. So I think there are many parameters to a normal.
To check that. And many people have gotten so comfortable with period pain. And as we've been talking about these, we realize that if you're having period pains, please don't get too comfortable with that. Could be a lot of things.
Could be a lot of things.
So this is just a reminder. If you're there and you are proving yourself to be a strong woman with period pains, you need to stop and go get checked because that's very important. Now, let's get to take a look at the myth busters so that we'd check some of the myths that surround PCOS and ovarian cyst, and then Doc will be telling us about the points that we'll see there. Tutatuambia kama ni ukweli ama they're myths. Before we come back to answer the questions, I still have your questions. We'll be answering them. But for now, let's get the mythbusters correct. So the first mythbuster that we have today is that ovarian cysts always indicate cancer.
Yeah, so I think by now you know the answer. That most ovarian cysts, and I think this should be the take home so that people don't panic. Most ovarian cysts are not cancerous because most of them will occur in the woman of the reproductive age. Only a small percentage are cancerous. The ones I want to take more caution maybe are if you are the older woman, above 40, 45, 50, or even in your 60s, and you have these big cysts. That one, the doctor has to evaluate seriously to make sure it's not cancerous, because those are the ones at risk of cancer. So yeah, most of them will actually not be cancerous.
Which is good news. The second is that birth control pills causes ovarian cysts.
Yes, the opposite is true.
The opposite.
Yes, that birth control pills can be used to prevent the formation of ovarian cysts.
Yeah.
Yes.
But
they don't cause.
Lazima imekuwa prescribed by your doctor.
Yes, yes.
Yeah.
Yeah.
Please, very important on that. The third one is that only older women get ovarian cysts. Is that true?
That one is, by now everyone should know that one is a lie.
Yeah.
You can get cysts, as I said, most of them will occur in the woman of the reproductive age who is ovulating. So from the time they start their menses until menopause, most of them will occur then.
Yeah.
However, even younger girls, children, I mentioned that type of cyst that's called a dermoid cyst. They can occur in the younger girls. The older woman can also get, so it can occur across all ages.
Yeah.
But the common ones in the woman of reproductive age, rarer ones in the children, and those ones you want to evaluate and find out there are specific types of cysts the younger girls will get.
Okay.
Yes.
Okay.
Yeah.
And the other one is that PCOS only affects overweight women.
PCOS does not only affect overweight women, yeah, but it's strongly linked to obesity.
Yeah.
And part of the problem is that they have this, again, as I said, they have a problem with insulin. So they have insulin resistance.
Yeah.
Yeah, and so with that, yeah, they tend to, it can be that PCOS can make someone to be even more obese, or even obesity can predispose. It's both ways, someone to PCOS.
Okay.
But we still have women who have normal weight, normal BMI, but they still have all their, remember it's a syndrome. They have the other features, facial hair, acne, the cysts are polycystic, the ovaries are polycystic, and also they have irregular cycles, and that they still meet criteria for PCOS. Yeah.
Okay.
But you'll commonly see it in the overweight and the obese women, but it can still happen in the normal weight.
Okay. Yes. Perfect. And the last one is that PCOS only affects reproductive health.
That is also not true. The word only usually doesn't apply in medicine.
Yeah.
There are always exceptions.
Yeah.
In fact, that's how you used to pass exams. When you see only, you're like, that one is a lie.
Okay.
So it does not only affect reproductive health, but its effect on reproductive health, we have looked at it. Yeah, from the way it will affect menstruation, it will affect ovulation, fertility, and all that. It has other effects, including the risk of diabetes, because of that insulin resistance, including the risk of, now with obesity comes, you know, the risk of heart disease, the risk of heart attacks and all that. So there are other general health problems that also can just come because of PCOS.
Okay.
And not only health, reproductive health. Yeah.
So umesema tukiona only kama mambo ya health hapo there's kuna
Kuna
maneno hapo.
Kuna only.
Okay. Where is it? All right. Anasema, hi Rachel, as the doctor, I had an ovarian cyst which was noticed to be endometriosis, and I have been done surgery 2 times and I still haven't conceived. What could be the problem?
Wow, endometriosis is the problem. Endometriosis, one of its main challenges is it can cause infertility. Or nowadays better preferred to be called subfertility, because you don't say anyone is infertile. Yes. So it has, endometriosis has a big impact on fertility. Actually, the statistics are 50% of women with endometriosis will have a problem with fertility.
Okay.
Like half the women who have endometriosis would have a problem with fertility, which is big. And how it causes infertility, there are many ways it causes infertility. Some we have already talked about. For example, this patient, she says that her cyst, she had endometriosis on the ovary, which we talked about. It's a type of cyst in the ovary related to endometriosis. It's called a chocolate cyst. And so what does that? It causes also inflammation in the ovary, so it reduces the egg quality. Again, it causes inflammation all around the pelvis. It changes the anatomy. So again, the tubes are not the way they're supposed to be. There's a lot of inflammation going on in that pelvis. It's not very good for the sperm. It's not very good for the embryo. So all those put together are how endometriosis affects fertility. So should just keep trying. My advice to them is that they should see a fertility specialist. Again, because for us women also, age is important, because again, you don't want to keep waiting 5 years down the line, whereas you had a better chance, 5 years ago. So the earlier the better.
Okay.
You can see a fertility specialist for that.
Okay. You'll be telling us where they can get fertility specialists.
Okay.
So that's something they'd ask. Asima, hi doc, I had a surgery to remove fibroids, but then my doctor said my tubes are not healthy because of infections. But after a few months, I went for HSG X-ray. One of my tubes is blocked, but the other one is not okay. I'm trying to conceive, but in vain. Please advise.
Yeah, so the HSG, what HSG is, it's a long medical term, but it stands for hysterosalpingogram. Hystero means uterus, salpingo means tubes. So it checks the cavity of the uterus and the patency of the tubes.
Okay.
So basically what they do, they push a dye in the womb and then they take an X-ray to see whether, they follow this dye to see whether it's, how it fills the womb and how it flows out.
Okay.
If the tube is blocked, it doesn't flow out. So that's how one tube, they said it's blocked. It didn't flow on that side. But on the other side, the dye was seen to flow. So that tube is open. That's good news for her. You only need one tube that is functioning to conceive. Yes.
Yeah.
So that's good for her, because if both tubes were blocked, we'd be talking of a different story. Yeah. So they should have a good chance with one tube.
All right. Yeah. So way forward for her.
Way forward, keep trying. We usually say you try for at least a year. Maybe she has tried for longer, I don't know, or maybe less. But if it's not yet a year, just try for a year, and that means regular sexual intercourse. Regular usually is like 2 to 3 times a week, medically defined like that, for a whole year, before we start now saying there could be another problem.
Yeah.
Yeah.
Okay.
So, and if it's beyond a year, then now we should check.
All right.
And find out what other problem is there. Remember there was a male factor. Remember there was an ovulation factor.
Yeah. Okay. We still have questions coming in, and I see our time is it's quite going, but I hope that we'll be able to get all the questions answered. If not, we'll be giving a number and location where you can get help. So usijali, we're gonna do that. And I say, thank you, Doc, for answering my question. Okay. So let's really try and answer questions on PCOS.
Yes.
And
not fertility.
Yes. Yes. So anything after over and above that, we are gonna have another sitting for that. All right. And so hello doc, I have a disturbing question. What are the real factors? Okay. No, this is also different, but we'll just answer it. What are the causes or factors that would lead a girl to be born without a uterus?
Today is that day you take me back to that embryology.
Yeah.
Embryology is like the science or the medicine of how things develop, all the way from, when they start forming. Yeah. So there is the embryology of how the female reproductive organs form. Okay. So simply put, there are usually some 2 tubes when the baby is forming in the womb, in utero. Very early, before week 9 of pregnancy.
Yeah.
There's some two tubes both genders have. One will form the female organs, one will form the male organs. Okay. So sometimes for one reason or another, they fail to maybe fuse or develop, and so when that baby is born, they might not have a womb, they might not have tubes, just because when you trace it back, those tubes didn't form well. I don't want to mention their names, because they're called Mullerian ducts.
Yeah. Okay.
Yeah.
Okay. Yeah. Medical terms, those ones.
So that condition again, it can be called a Mullerian duct defect. Yeah. And an example is absence of a uterus. It's a Mullerian duct defect. Because the underlying problem is that those ducts had a problem forming.
But then there's really no way to correct that after?
If it's absent, there may not be a way to correct it.
Yeah.
There may just be interventions to just improve the quality of life, because for some even the vaginal canal doesn't form. So for those, you know, they can be sent to have some corrective surgeries, you know, so that they have a normal life. But then counseling becomes very, very important, because you want to counsel them that, you know, you may not be able to carry a baby, but for them, if the ovaries don't develop from those tubes, so they could be having their ovaries. So if the ovaries are there, it means they have eggs. It means that their eggs can be used to fertilize, to be fertilized, then someone can carry a baby for them. So those options of how they can be a mother can be discussed. And even support groups. Support groups are there. There are people who live with those conditions. And so support groups should be there for that.
I see. We have this person who've asked this question so many times that you've already answered it, but maybe you can just answer them again about PCOS causing infertility. You've called it subfertility.
Subfertility.
Yes. Would it cause PCOS? Would it cause subfertility?
Oh, yes. And we have explained how. But I don't want people to leave this discussion saying that PCOS causes infertility. Because most patients with PCOS will conceive naturally without any help, without any medication. Most of their cycles is true, they are not ovulating, but once in a while they will ovulate. And if you give them that 1 full year we talked about, a good number will come back pregnant. Actually, most will come back pregnant. But for the few who are not able to conceive, then we know that the ovulation is the problem. Because it's just because they are not ovulating. And so the target would be to make them ovulate.
All right. But you've said most of them
will conceive naturally.
Which is good news.
Yes.
Which is really good news there. Lisa, hello doc. I have ovarian cysts. Will it be linked to endometriosis?
Yeah, we think we've talked about the link of ovarian cyst and endometriosis. And specifically, when you have endometriosis on the ovary, it can form a cyst, and it's called a chocolate cyst. Yeah, that's the link that is there. Yes.
But it's also treatable?
It's also treatable. But most of the time, it's surgical. Those endometriomas, they just need to be removed because they cause a lot of pain also. Because endometriosis in itself causes pain. So endometriosis in the ovary, you can imagine, it causes also a lot of pain. So it can be removed surgically. And now, just to mention, not all cysts we have to cut open like a cesarean birth. We have, now we are moving to what we call minimally invasive surgery, where we use very small cuts on the abdomen just to improve cosmesis and also for quicker recovery, shorter hospital stay. So if the cyst is not too big, there is no suspicion for cancer, it can be removed laparoscopically. Or using camera surgery. Yes, it can be done.
So that's usually the small holes.
Small holes. And usually just put a camera through a hole on the belly button. Then with the camera on a screen, we're able to see inside very nicely. You're able to make diagnosis of endometriosis. You see where the cyst is. And the cyst can, with another small tiny holes, less than a centimeter on the sides, with very small instruments, then we are able to remove the cyst. And then you go home the next day instead of being in hospital for 3 days.
The next day?
Oh, yeah. Small incisions, less pain.
Unamaliza.
Faster recovery. Yeah, that's where we are moving to.
Which means that there is, that's good news. That's good news. If you're having any issue like that, please go get checked. Go get checked. So we are having the lady who talked about having fibroids removed and then had the HSG X-ray. She's giving a feedback. She's saying everything else is okay, uterus is okay, my period is regular, my husband is okay. It's secondary fertility.
Not secondary.
Yeah.
Secondary just means they have conceived before. Either they have conceived before. It's not the first time they're trying. That's good news. If everything is okay, it means that chances are very good. There's a small entity called unexplained subfertility. Unexplained. And that would be because, you know, all your tests are normal. Your tube is parted, you're ovulating, the spouse is okay, everything, all the tests are looking good, but then it's still not happening. So I would say if it has taken a bit long, maybe it's now 2 years now, just have a discussion with a fertility specialist, please. So that now you can also now discuss what additional options are there for you. But that said, you could still conceive naturally.
Yeah.
We don't know when. God knows.
Yeah. God knows.
Yes.
God knows. This is mambo mingi tunachia to
Yeah.
God because, yeah. Anasema, is ovarian cyst cancerous? I think we've answered that and said.
Answered.
Most of it is just not cancerous.
Yes.
But you need to go get checked.
Yes.
So that you know if it's cancerous or not. Yeah. Okay? Anasema, hi doc, I have been tested and I have no cysts, no fibroids, but painful pelvic, something I've not understood, but I think she's having pain on the pelvic area. But anasema amekuwa tested, anasema no cysts, no fibroids. Then what would be the issue?
That would fall into a class of something we call chronic pelvic pain. It is one of the reasons a lot of women come to see us. And basically what we do is we want to find out whether there's any underlying cause first of all. So is there any infection anywhere, then we treat that. You know, is there endometriosis, then we handle that. Is there something else called adenomyosis and many other causes of chronic pelvic pain. But that said, if all of them, they are not there, then they could just be having this, what is it called? It's the perineal, they just have this perineal pain. Sometimes there are a few people who have this perineal pain. So sex becomes very painful. Passing urine also becomes painful. So it's a painful perineum problem. There are few people who get that. It's a chronic pain condition. And there are some treatments tailored towards that. But first of all, we have to rule out the common things first.
Okay.
Before we say it is the one.
Okay. Now, looks like we'll be giving a number at the end of this discussion or allocation so that you'd be able to answer the rest of the questions. But for anyone who's, after this conversation, they've decided they need to get checked or they've heard they have some of the symptoms, of course you need to go to hospital. But let's talk about the lifestyle that you are saying. What is any woman, any woman supposed to do generally in terms of lifestyle just to make sure that they avoid such things like PCOS and ovarian cyst and many others that are on that line? Yeah.
All right. So PCOS, to some extent, there's no control on whether you'll get it or not. But for those who have, then there are things you're supposed to do. Also to just reduce your symptoms and to make your life better and to reduce the complications that come with it. And I said most of its treatment is lifestyle modification. So for lifestyle, this cuts across board a healthy diet. I think there was a video you showed before, which people should go back that explained exactly, you know, what to eat. If you have PCOS, it should also be a good idea to sit down with a nutritionist, just a professional in that area, and just sit down with them, and then they explain to you, you know, these are the options you have for breakfast, for dinner, for lunch. These are the snacks you can get, so that you're getting the right diet going in. Most of its aim is because you have this insulin resistance, so you want to really lower your blood sugars because there's a sugar control problem. The other thing is because you are also wanting to lose weight. Weight loss, we have already said, it has a lot of benefit in PCOS. And as I said, even when you come to see us and PCOS is a problem, conceiving is a problem, the first line thing we'll tell you is that you need to lose weight, and that is like 5% of your weight. So if you lose 5% of your weight, it's been shown that your ovulation kicks back, your hormones balance, your periods go back to regular. You know, that's not no medication, nothing. So just getting a good exercise regime. And what is a good exercise? It's 30 minutes. If you can, every day, but if not every day, 3 times a week, 30 minutes of some moderate to vigorous exercise that makes you break a sweat. You decide what that is. Can be some aerobics in the house, can be brisk walking, can be jogging. If there's a gym near you, you can get an instructor, you can join.
Okay.
But just to realize that just losing that 5 to 10% of your weight, actually the more you lose, the better.
Okay.
You're able to just restore the function. Yeah.
I see. Now, I'll just add these, Mahali, from where you've left, and tell us if it's something people can do. She's asking, can they use herbs like rosemary to reduce the risk of getting ovarian cyst?
Now, when it comes to herbs, no, what I'm discussing is conventional medicine.
Yeah.
Conventional medicine means it's been studied for a long time. Side effects are known. They are approved medication. When it comes to herbs, I may not have a lot of input on them.
Yeah.
But all I can say is that, you know, there are some spices, they're healthy for you. They're good even for the woman health.
Yeah.
Things like rosemary, things like cloves, things like soya, all those things. You can, and just goes back to diet.
Yeah.
Really. Yes.
Being healthy.
But now you going to a miti shamba,
Yeah.
now that one I may not recommend.
Yeah.
Why? Because most of these things you don't know, not much tests have been done on them. You don't know their side effects. Yes, they could sort out your problem, but you also don't know what side effects they are causing.
Yeah.
You don't know how good they are to your liver, or whether they are causing your liver to fail. Yeah.
Okay.
So be very careful with herbal medication.
Yeah. Very important. Yeah. That's very important. Now, because you're just about to get the contact and anything else that you might need to be able to get help, let's take a look at healthy living once again, because we've talked about living healthy, which is very important. Eating well, being healthy, taking your time to exercise. So let's take a look at healthy living once again by Sylvia Wanja, so that you can take a look at it and be sure to also just apply it to your life. Isikome tu, and that is it. All right. So we'll get that segment and then we'll be coming back to wind up.
Hello and welcome to Healthy Living. My name is Sylvia Wanja. Today we're going to talk about managing PCOS and ovarian cysts. Managing polycystic ovarian syndrome, that is PCOS, and ovarian cysts involves a combination of lifestyle changes, medical treatments, and regular monitoring. Both conditions are related to hormonal imbalances that affect the ovaries and can lead to a variety of symptoms such as irregular periods, fertility issues, and cyst formation. Here's how to manage them effectively. Number 1, adopt a healthy diet. Balanced diet. Focus on a nutrient-rich diet with plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Low glycemic index foods. Choose foods that have a low glycemic index, such as whole grains, legumes, and non-starchy vegetables to help manage insulin levels, which is important for people with PCOS. Manage weight. If overweight, losing even a small amount of weight can help regulate periods and reduce the risk of further complications. Anti-inflammatory foods. Incorporate foods like fatty fish, nuts, seeds, and olive oil to reduce inflammation, which is often present in PCOS. Number 2, regular physical activity. Exercise regularly. Aim for at least 30 minutes of moderate exercise most days of the week. Activities like walking, jogging, yoga, swimming, or cycling can improve insulin sensitivity, reduce symptoms, and support weight management. Strength training. Include strength training exercises twice a week to build muscle mass, which help regulate blood sugar levels. Number 3, monitor and manage ovarian cysts. Regular ultrasounds. If you have ovarian cysts, regular monitoring via ultrasounds can help track their size and prevent complications. Pain management. Over-the-counter pain relief such as ibuprofen can help manage mild pain caused by ovarian cysts. However, consult a healthcare provider if pain is severe or persistent. Watch for complications. If cysts rupture or cause torsion, that is twisting of the ovary, immediate medical attention is needed. Surgical intervention. In cases where cysts are large, persistent, or causing significant symptoms, surgery may be required to remove the cysts or, in some cases, the ovary. Number 4, addressing emotional well-being. Stress management. Managing stress through yoga, meditation, or relaxation techniques can help with hormone regulation and overall well-being. Therapy and support groups. The emotional impact of PCOS and ovarian cysts can be significant, so consider seeking counseling or joining support groups to manage the mental health aspects.
So that is it on a healthy living, and I hope that you've taken some lessons from there and from what Doc has said, that you really do need to eat healthy. Just stay healthy. I feel like after you've had most of the conversations here zote about diabetes, what you've talked about, what mostly we call heartburn, every discussion that we've had here, tunamalizanga, please live healthy, please exercise, eat well, drink water. So that should be it, the underlying thing about your health. Please eat healthy, check on what you eat. It's very important. Tuliwapea ruhusa ya kukula vizuri over December. Now it's time to eat healthy, okay? It's very important. Now I'll just go through some of the, there's a very amazing comment here. This one I'll read on air. She's saying, I really love this woman, Dr. Dorothy McKenna. She has a very big heart, always busy and a timekeeper. Yeah, she's a timekeeper. May God bless her even more. Keep it up, Dr. Ari Evaliu. I think this is someone that you've treated. Wow. Yes, I'm sure this is someone that you've treated. Thank you Asante sana, Jacinta. I see your message. You have Dora Mwanza. Anasema, that's my doctor. We have now Naomi Mboro. I see you. We have Mary. Thank you so much. Mwaz Timono jumbe wako. Mwange Weragwe. I've seen your message. Tuko na Mary Youngster. Asante sana. Thank you guys for tuning in from this side. I see you, and I hope that you've been informed and well helped on this conversation. If you have any other question, we'll be giving a number, and you'll be able to follow up on that. Sure. Now, I feel like we should be winding it up on that, but before we wind up, it's very important for us to get to know what would be your parting shots on the conversation that we've had today. You'd tell us one about PCOS and one about the ovarian cysts. Yeah.
So my parting shots, I'll just be reiterating what you've already said. For PCOS, it's a common condition. I didn't mention the statistics. It affects up to 8 to 10% of women. So it's possible that 1 in 10, or 8 to 10 in 100 would be dealing with PCOS. So do not be afraid. Reach out to your healthcare worker. Management can be tailored to what you want. If it's regular menses that you want, that can be sorted. If it's conceiving that you want, that can be sorted. If it's dealing with the other things, acne and facial hair, that can also be sorted. So reach out. Help is available and treatment is there. That's what I'd say about PCOS. And they should be able to lead a healthy life, just a normal life like any other person. For ovarian cysts, the take home is do not be afraid. People see a cyst, they're like, hey, I'm going to die. That's not true. I think I've demystified that. 90% of cysts are not cancerous. Therefore, do not be afraid. Just reach out to your healthcare worker, let them examine you, get an ultrasound done, and most of them, the treatment will just be conservative. We just follow it up with a scan after some time, and it will be gone. And those that need a bit of further treatment, that is available. So do not be afraid. It's not a death sentence. Most of the time, it is not. That's all I'd say. There's help. There's help.
It's really important. And I'm really glad that you've demystified the fact that most cysts are cancerous, because that has been the...
Are not cancerous.
Are not cancerous. Yes. They are not cancerous. Yes. Most of them are not cancerous. And that's very important, because most of the people would think, as you've just said, okay, NVC is talking like, hey, now this is it. This is a death sentence. Nothing can be done about it. But it's good that you said, even for that, there's help. Okay. So for anyone who's listening to you and they now need to get checked and they feel like they have symptoms that they need to just be sure it's nothing very dangerous, where can they get you? Do you have a number? And also give them a location.
So I practice in most hospitals in Nakuru. But primarily, the main clinic I run is found at Aga Khan, West Side Mall, on first floor. I go there on Tuesdays and Thursdays. On Wednesday, I go to Karen Hospital. It's on Tower 1, ground floor. Those are the two primary places you'll find me in. However, any other facility I work with in this city of Nakuru, You could reach out on this number if you need to make an appointment.
Yeah.
That is 0745 47 45 42. I repeat that again.
Yeah.
0745 47 45 42. Yeah, that's Dr. McKenna.
Yes.
You're welcome.
Perfect.
Thank you.
Asante Sarah. Thank you for being with us on this show today.
Yeah.
And I'm sure that most of the people have been able to learn and also just get knowledge, maybe would help someone else. So this is also to say that it's very important for you to share this link as much as you can. It's on Facebook, on MBCI TV. It's on YouTube, on MBCI TV official. So share this to all your friends so that they get this knowledge as well. It's very important to all of us, especially since you've had the statistics. It's very important for us to share so that those who need to get help would get help. We've said the earlier, the better.
Sure.
Okay? So asante sana.
Karibu.
Thank you so much. This has been a good session. We've been able to answer most of the questions, by the way. And those that we've not mentioned, I'm sure tumezijibu kwa swali ingine. Someone has asked almost a similar question to what you've asked. But if we've not been able to ask your question, to answer your question, we've given the numbers that will be on our screens in a very short while. And you'll be able to ask whatever you need to ask. Go get checked. Na hiyo maneno itakuwa iko sawa. Others, thank you so much for tuning in today. Thank you. We've had a good time. We wouldn't have done this if you weren't there to watch and follow and ask the questions, because we're here so that you would get help as well. We've said that Afya Clinic is where we talk about everything health in general. So thank you so much for tuning in today. God bless you. God be with you. Maybe we'll just repeat the number one more time and then we'll be winding up on that as we get Did You Know. So maybe just give us the number one more time. Yeah, it's on your screen. But just, yeah.
Yeah, and that's 07 45 47 45 42.
It's very easy. It's really easy. Yeah, tamkwe tunayo offhead, just in case you need to call anytime. Yeah. Others, thank you so much for tuning in. God bless you. God be with you. Have an amazing rest of the day. But before we wind up, we must have Did You Know by Mandaliwa, another one and only Martin and Charles, right? So this helps you to jog your mind a little bit as you wind up today's show. So did you know that a shark's liver is so large that it makes up to 25% of its body weight? Are we talking about liver? Okay, this is very interesting. That a shark's liver is so large that it makes up to 25% of its body weight. Why does a shark need such a huge liver in its body? Really? Why?
But the liver is actually, even for humans, the second largest organ.
Okay.
After the skin is the largest organ.
Then the liver?
Then the liver. It's huge.
You know,
it has a lot of function.
Oh, really?
Yeah. Cannot survive without a liver.
They have to go check where. Okay. Please go research about the liver. Now that's very interesting. Go research. That's why we have the duties every day, but for us every Wednesday after this show, so that ukimaliza pia unaenda ukijog your mind around it and go research, because that's very important. Otherwise, once again, thank you so much for tuning in today. Tunakupenda sana. Have an amazing rest of the day. Remember that today being a Wednesday, we'll be having the lunch hour from 12:30 to 2:30, but today's outline, the program is very friendly for you and your family. We say that MBCI TV is a family TV. So, usiende mbali, please stay tuned in from now mpaka June. All right? You're going to be having an amazing outlay for you. Please enjoy and have an amazing rest of the day. God bless you. God be with you. Once again, Doc, thank you so much for coming today.
Yeah.
And we're looking forward for more conversations.
Thank you for having me.
Asante sana.
Asante.
Yes. So if you have any other topic you want us to talk about, our WhatsApp number is very open. No, this is only WhatsApp, 0721-105-105. If you have anything you want us to talk about, is it diabetes, anything you want us to talk about in terms of health, we'd be able to talk about it. Please tell us through our WhatsApp number. Okay? Have an amazing rest of the day. My name is Rachel Kahugu. I'll see you next week on this particular show. Bye-bye.